Hi, my name is Jacqueline Rangel, and today I'm going to be presenting on our Week 7 signature assignment, which is to create a public health program or project. In this case, I chose Kaiser Permanente, and today I'm going to be presenting my C. diff prevention presentation. So, let's introduce Kaiser Permanente first. It is a nationwide renowned managed care organization with a network of healthcare facilities in 8 states across the U.S. that have well-trained healthcare providers that offer care for multiple health issues, from a head-to-toe assessment to the welcoming of a new baby, to health educational programs. Kaiser Permanente offers a multitude of resources to its members and its communities. So we have Kaiser Permanente Northern and Southern California. So Kaiser Permanente California operates 21 hospitals and has 4.4 million members. That's part of Northern California. And Kaiser Southern California has 259 healthcare facilities, including medical offices and hospitals. Their mission statement is, Kaiser Permanente exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. So what inspired me to choose Kaiser Permanente is multiple reasons. Well, first of all, my health insurance is with Kaiser. Second of all, I had a car accident 3 years ago, and they took care of me, and I was impressed by their care and their professionalism. Third of all, I did my research, and I discovered that Kaiser Permanente in Northern California has an exceptional C. diff prevention program, which started to be implemented in Kaiser Permanente Redwood City up north, Northern California. And what I found was this medical center has the lowest rate of C. diff among the organization's 21 Northern California hospitals. In 2018, the medical center had 0 cases of hospital onset C. diff. Since January of 2015, the region's 21 hospitals in Northern California have seen a 40% reduction in hospital onset C. diff. Kaiser Ontario and Kaiser Fontana, which is close to where I live in Southern California, are the closest to me, and they had 28 cases and 44 cases respectively in 2018. So as you can see, it's a great difference there. I researched the Kaisers throughout Southern California, and the majority were 20 cases and above for 2018, compared to 0 cases in Redwood City, and across Northern California, it's much lower. So this is what inspired me, and my public health contact information. So I don't know if you could see there, but the public health contact I was able to get was Andy, and his title is Healthcare Educator #2 in Preventive Medicine and Health Education. I emailed him, and he replied explaining that he and his team members are currently working off-site or out of the office due to the COVID pandemic, and they did not know when they would all be back in the office. So long story short, he was not really able to help me much because he said because of the whole coronavirus, they're not in the office and they're not really meeting up to discuss programs. So what I decided to do is to create a mock interview and public health project for C. diff prevention efforts in their healthcare facilities. So my project proposal for C. diff education presentation. I want to use Kaiser Redwood City's protocols for C. diff prevention as a model to create a C. diff prevention presentation that will be used throughout all of Kaiser's facilities across Southern California. All of Kaiser's staff must watch and learn this presentation upon hire and understand it is crucial information to prevent the spread of infection, specifically with C. diff. So this is the beginning of my project proposal. Content will include educating all staff about C. diff facts, causes, and transmission in order to improve infection prevention efforts. Number 2, how to follow proper protocol for C. diff. Number 3, how staff can educate patients and families. Number 4, how to mark rooms appropriately and separate patients accordingly. Number 4, careful C. diff testing. And the last point is importance of having a multidisciplinary infection control team. So let's start and let's discuss what is C. diff. Clostridioides difficile is a bacteria that can cause infection in the gut, which irritates and inflames the colon if the following occur. If the C. diff bacteria is ingested and the normal bacterial flora is disrupted by antibiotic use. So what happens is when we take antibiotics, our bacterial normal flora in our intestines and our GI tract in general are wiped out. So if there is the C. diff bacteria and it starts to colonize, then patients can get really sick because they don't have that healthy bacteria to protect themselves. Symptoms include watery diarrhea, abdominal pain, tenderness, fever, nausea, and loss of appetite. The C. diff bacteria can live outside of the body for months and can spread in healthcare settings by physical contact with items such as medical equipment, and also can spread from person to person by touch. Who is at risk? Why is prevention important? The individuals at risk are those that are taking antibiotics, as I mentioned. The elderly and people with certain medical problems are at high risk of infection. The significance of C. diff prevention is C. diff causes approximately 500,000 sicknesses in the U.S. each year. An estimated 1 in 6 patients who get C. diff infection will get it eventually again in the next 2 weeks. Within a month of being diagnosed, 1 in 11 individuals over the age of 65 died of a healthcare-associated C. diff infection. So as you can see, the elderly are very vulnerable to this infection and it can be fatal for them. So that's why we want to prevent this as much as possible and protect our patients as much as possible. C. diff prevention protocol. So this is a protocol that is evidence-based and that I want to implement in all Kaisers across Southern California. Patients infected with C. diff must be put on contact precautions immediately. Contact precautions requires the healthcare team taking care of that individual to don gloves and wear a gown over their clothing while providing care. C. diff patients should have their own private room or share a room with the patient with the same infection. Wash hands before and after caring for every patient. Only give patients antibiotics when completely necessary. It doesn't stop there. Let's continue. How to educate patients and families. Upon diagnosis, patients must be informed immediately on what to expect treatment regimen and how to prevent the spread of infection. We want to educate patients and family members what they need to do to protect themselves and others. So patients must wash their hands after using the restroom, because that's how it's passed, through the feces, fecal oral. All family and visitors must wear gloves and a gown, especially if they are helping to provide care. Do not eat or drink in the patient's room, and do not use the restroom in the patient's room. Ensure patient and families understand how to prevent spread by asking them to repeat what was taught and have them teach other visitors. This is something I feel is a very important part of the protocol and infection control in the hospital for C. diff, multidisciplinary infection control team. So what I read about the Redwood City Kaiser is that they have a multidisciplinary infection control team for C. diff that has helped them exponentially to prevent this infection. So as I said, the Kaiser Redwood City has key leaders that make up the C. diff infection control team. They consist of Manish Basista. She is an infection prevention program manager. The second individual is Poonam Kapadia, MD, assistant physician in chief of quality. The third important key member is Eunice Jones. She's an RN and she's an area quality leader. So this MD, she stated that their success is due to extensive hands-on work and thoroughly educating frontline staff to ensure each potential C. diff case is handled appropriately. So as we can see, what they're saying is if we educate our staff adequately and thoroughly, then most likely we will be successful. And we have to have a protocol system established and in place so that it can be easier for staff to follow. Careful testing is very important. For example, we have different staff in a hospital. We have CNAs, LVNs, x-ray technicians, radiology technicians, you name it. So these these healthcare members, they are part of the healthcare team, right? So they need to be in communication with each other, especially the nurses. If a nurse is assessing a patient and she notices that the patient starts to develop diarrhea, she wants to do a further assessment, and this is gonna sound a little TMI, but she might want to she might want to analyze the smell, because C. diff patients tend to have a specific fecal smell, and it's very potent, and most nurses can recognize it just like that. So once they detect C. diff, they can report it to the doctor, and we can then have a C. diff test conducted to make sure this patient doesn't have a C. diff and to rule it out, because better safe than sorry. These are the MPH foundational competencies that apply with this presentation. So the first one is communicate audience appropriate public health content, both in writing and through oral presentation. Second one, apply epidemiological methods to breadth of settings and situations in public health practice. Number 3, design a population-based policy, program, project, or intervention. 4, interpret results of data analysis for public health research, policy, or practice. 5, apply principles of leadership, governance, and management, which include creating a vision, empowering others, fostering collaboration, and guiding decision-making. Based on my entire presentation, I think all of these MPH foundational competencies apply. And these are my references. Thank you very much for listening.